and welcome to Healthy Living. I'm Debbie Lyons. I am here today with Kelly Presnell, Director of Marketing and Public Relations. What are we talking about today?
Today we have Dr. Carmen Traywick. She's a board-certified dermatologist who is here. Recently new, you know, she's been in the community for over 3 years. So
yeah, first time we've talked to her.
Yeah, so it's, you know, dermatology, everybody's concerned about the sun. We, you know, we want to be outside, enjoy the beautiful weather. That's why we've chosen to live here. So, you know, we want to learn about proper skincare, what kind of sunscreen we need to be using. So she's going to talk a little bit about that, and we're proud to introduce her to everybody here.
I'm excited to talk with her also. So stay with us. We'll be right back here on Healthy Living.
Excuse me. Hi, can I get through, please?
Dr. Newton.
You know, there has to be a better way. A way to skip the ER waiting room. Like this lady over here. All she did was log on to inquicker.com to hold her son's place in line. Now they can wait at home and skip the ER waiting room. Now, which would you choose? This or this? Hold your place online at inquicker.com and skip the ER waiting room. Ooh, is that hot cocoa? Oh, help yourself.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
We are here today with Dr. Carmen Traywick. Thank you for joining us. She is a beautiful dermatologist. You have gorgeous skin. I mean, you really do. This is the first time we've actually had the opportunity to talk, so thank you so much for coming today.
Thank you for having me.
Can I talk a little bit about your background, where you did schooling, and how long you've been here at the hospital?
Sure. Well, I came here from Atlanta. I trained at Emory University in Atlanta, and I did my undergraduate training, medical school, and residency there.
That's great.
So I spent a lot of time in Atlanta, 12 years there, and then I'm originally from South Carolina. I grew up
you are?
Yeah, I grew up in Lexington, outside of Columbia.
Okay.
And so we used to come to Hilton Head for vacation. So when
you thought,
why not go live where we vacation? So I came here about 3.5 years ago and started my practice. And
do you do a specific kind of dermatology, or are you broad spectrum, do a lot of everything?
I'm kind of a general dermatologist.
Okay.
I do a lot of, you know, skin exams, rashes. We do skin cancer treatments, and I do a little bit of cosmetic dermatology as well.
Enjoy that too?
Yes, that's great.
Is that why your skin looks so good? No, it's because you're very young. What do you see down here? And let me be specific. As we get older, what kinds of things from a skin point of view should I be aware of? I know we talk about the sun all the time, and we can talk about that in a moment. But again, how often do I need an examination? What does that look like?
Right. Well, where we live, obviously, people live here because they want to be active, they want to be outdoors. That means a lot of sun exposure. We have nice weather, so people are out a lot. So we have actually a very high incidence of skin cancer in this area. So it's really important that people protect themselves. Generally, it's good if you never have had a baseline skin exam to go and get examined. And usually based on that, we would recommend how often that people would come in and get checked.
And I know you've got 2 little kids. What do you recommend for moms who have children, as far as, I hear different things about sunscreen, no sunscreen, at what age, exposure, do I put them in long sleeve shirts when they go to the beach? What are your thoughts on all of that?
Well, there's various things. I personally, with my children, just because they kind of complain about sunscreen, it's a lot of work to put it on and on. So I really love the little sun shirts, and they make cute ones. I have 2 girls, so they make little cute ones for girls sometimes, and of course the ones for little boys are cute. And the great thing about those is once they have that on, if you have a good shirt, you don't have to reapply sunscreen to their back, their chest. It's just easier. On the areas that are exposed, sunscreen has to be reapplied every 2 to 3 hours, stretching it. So really, that's a lot. If you're at the beach all day, you have to keep putting it on, and especially when you get sandy, it gets to be a little a lot of work.
Are there areas of their bodies and our bodies that are more vulnerable to skin cancers?
Well, the areas that I see, we have a lot of golfers in the area, and so usually the golfers don't realize how much sun they get. You know, they go and play 18 holes of golf, and they said, well, I didn't go lay at the beach, but they were out in the sun a lot.
Okay.
So the areas
like
that,
arms,
right,
or, yeah.
The areas they tend to forget would be tops of the ears. See a lot of things happen there, and then the back of the neck.
Oh, I never even thought about that.
So,
and I guess, you know, I'm looking at the parts of our hair. I never would have thought about that either.
And then, you know, the tennis players, a lot of times people wear a visor, which is great because it covers a big part of your face, but if you have a part in your hair, that still gets a lot of sun, and we do see, you know, some lesions that develop up there for women.
How often do you suggest that we do come in for an exam?
Well, generally for anyone who has a history of precancerous or skin cancerous lesions, at least once a year for an exam. The other thing would be if you have a family history of melanoma, that would be your parents, siblings. If any of them have had melanoma, at least once a year check, even if you personally haven't had any. I have some patients who've had a melanoma. They come even up to every 3 months, depending on how advanced their skin cancer was.
And how old do I need to be to come for my first screening? In other words, do I bring my 12-year-old son? Do I bring my 30-year-old?
Generally, the pediatricians are really good if you take them for their annual exam at watching for things like that. Of course, if your children have anything strange, a mole that looks really dark or changes, then have them come in. Generally, I don't do a lot of routine exams on children.
Kids. Okay.
I would say most people start coming maybe in their 30s to 40s. Depending on their amount of sun exposure and again their family history and risks.
It's so funny because I do think so much about skin cancers when I think dermatologist, but that's just a wee part of what you do, really, isn't it? What are some of the other things? You kind of gave us an overview, but things that you specifically see here.
Right. We also do things like we treat acne. That's a huge thing for children, teenagers.
And what is the treatment now for acne?
Well, there's a lot of great treatments now. Most treatments are topical, which is nice because they don't have a lot of side effects.
Okay.
And we have some really great combination treatments that work great for acne. Sometimes people have to take pills, like antibiotic pills, for a while to get it under control. Is
acne something that is eventually going away? Because I don't see a lot of kids with severe cases of acne now. And the other thing along the lines of acne is I have a 33-year-old daughter, and she's talking all the time about acne outbreaks now that she's had kids. Yeah, acne is triggered by, a lot of times, by hormonal changes, and so that happens in teenage years, but we're seeing a lot more women kind of in their 30s or around pregnancy, before and after, with a lot of hormonal changes that can lead to acne outbreaks. What happens? Why? We don't really understand exactly all of the mechanisms for that, but any fluctuations like, you know, high levels of estrogen or dropping levels of estrogen can trigger release of actually testosterone, which is one of the things that can lead to a little bit of acne breakouts, even in women. And are there people who are prone to acne? Because you see some people that just have this beautiful complexion and other people where it seems to be a chronic problem. Right. People are definitely born with different skin types. And some, usually if children have eczema, which is a dry skin condition when they're a child, they don't have acne when they're older because they don't produce a lot of oil in their skin. Interesting. Okay. But some people are prone to producing more oil, and that is what sort of starts the cycle of an acne bump, is the oil production. So it's definitely a genetic component to it. And you know, you talked about doing a bit of cosmetic dermatology too. I mean, you can't look at any magazine, you can't read any, listen to TV without hearing all the cosmetic kinds of, what? Procedures. Procedures is the word I was like, well, what do you call those things that everyone is having now? What are you seeing? What's popular? What works? What do you recommend? Well, there's so many great new things that are available. Be specific. Right? There's so many great things that are available that even 10 years ago we didn't have in our toolbox to use. So everything from starting with just skincare, just basic topical creams and treatments and prescription type of medications that we use for anti-aging, for prevention, and to reverse some signs of aging and sun damage. Then you move up into injections, and there's many different types of injections now. Some I'm sure you've heard of Botox. Oh yeah, that's what I've heard of Botox. Okay, so Botox is one treatment that we do. It is injections, and what that does is actually relax muscles in the face so that you don't have wrinkles created when you move the muscles. So it's actually a muscle relaxation type of treatment, injection. And there's other injections that actually fill in creases, so fill in wrinkles or little valleys in our face, so it gives more youthful appearance.
Those are the main types of injections.
Side effects with those? Is there? Do you teach prevention also, as far as, you know, cover your face, don't get sun?
Definitely, definitely. I mean, I pretty much every patient would recommend a sunscreen every day. People don't realize that even just the 5 minutes that you drive or 15 minutes that you drive to or from an errand in the car, actually the UVA light still goes through the glass. You don't get UVB rays, which cause you to burn, so you won't burn through your glass in the car, but you will get UVA rays, and those cause aging, they cause sunspots, and they cause skin cancer. So I recommend every day. Some women use it with their makeup. They have sunscreen in their makeup, so that's their everyday, at least on their face, some sunscreen. And I'm not saying you have to slather yourself from head to toe every day, but facial sunscreen. In fact, we see a lot more skin cancer on the left side of the face, and that's because being in the car, you constantly, when you're driving, you have rays on the left side. So that just shows you right there. It's not necessarily your long day at the beach laying out, but your daily sun that really adds up over time.
Are some people more prone to get skin cancers, or are they more prone to get like a basal or a squamous or melanoma? Or?
Yeah, I mean, I would say the kind of the worst skin type for skin cancer is Irish skin.
Okay.
I have a patient who has Irish heritage. They're fair, you know, freckled, maybe even redheaded, or had that family ancestry. That skin doesn't tolerate our sun, especially here, very well.
So it's more of a toleration of. Okay, that makes sense to me. And they're more prone to getting a skin cancer.
They're more prone to all the types: basal cell, squamous cell, and even melanoma. So
we're going to take a quick break. I want to come back. We've got lots more to talk about. Stay with us. We'll be right back with Dr. Traywick talking about dermatology.
Excuse me. Hi, can I get through, please?
Dr. Newton.
You know, there has to be a better way. A way to skip the ER waiting room. Like this lady over here. All she did was log on to inquicker.com to hold her son's place in line. Now they can wait at home and skip the ER waiting room. Now, which would you choose? This or this? Hold your place online at inquicker.com and skip the ER waiting room. Ooh, is that hot cocoa? Oh, help yourself.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000, on the web www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hilton Head Hospital.
We are back here on Healthy Living. We're talking to Dr. Carmen Traywick. We're talking about dermatology, and we've been talking and talking and talking there. I think everyone has questions about it, and we've been talking about different kinds of sunscreen treatments. What do you recommend? What do you like? What's an important active ingredient that we need to pay attention to?
Sure. Sunscreen is really important. I'll tell you, the number one thing about sunscreen is that you actually use it. And that you reapply it every 2 to 3 hours. And that seems very simple, but some people will put it on, you know, say early in the morning before they go to the beach, and you know, a couple hours later it's gone. So, you know, that's really important. This sunscreen that I like the best are physical blocker sunscreens. There's 2 different types. There's one type of sunscreen that actually absorbs the rays from the skin, from the sun and distributes them so that you don't burn. And there's another type of sunscreen which actually blocks the sun from penetrating the skin.
Okay.
The blocker kinds are zinc and titanium. That's the two active ingredients that you would look for in a good sunscreen. That's
Don't you remember
what I prefer.
the old zinc oxide that all the little lifeguards had on their
Right,
hands?
yes, and it does not colored, well, you can still get pink or green or white, but the newer zincs do actually rub in, and they start off white so you can see where you're putting it, but then it eventually turns clear as you rub. And so it can be a little tricky to find sunscreens that have that, but if you look at the drugstore or wherever you are, you have to turn the bottle around and look at the actual active ingredients and look for zinc or titanium. That's important.
You were saying during the break that you have a really good one at your office.
Right. Well, most people, or a lot of people, like the spray sunscreens, and it's really hard to find a spray sunscreen that has zinc in it. We do carry one at our office that I feel is very nice, not very greasy.
Okay.
And a lot of the golfers like it because it doesn't leave their hands greasy when they reapply.
When you put a sunscreen on, do you have to make sure that you wash it off afterwards when you go home? I mean, are there any adverse effects to the sunscreen at all?
No, there's really no adverse effects. Next time you take a shower or you wash it off, that's
it just
no
comes
problem.
right off
Yep.
anyway. I always
It's gonna
wondered
come off.
about that.
Right.
One of the things we were talking about too is not just skin cancer, but eczema. What is that?
Right. Eczema is a condition of dry skin, and so many children have eczema, usually starting around 2 or 3 years old. They'll get little patches in the bend of their arm, their elbows, or their knees. And
caused by?
It has genetic components. It has to do with where you live and the amount of humidity in the air. We're lucky here, actually, we have
a lot of humidity.
A lot of humidity,
yes.
so we don't see as much eczema here as we would say up north. But the level of moisture in the skin is lacking in children who have eczema. So there are children who have it, and then usually middle adulthood, there's not a lot of eczema, and then as people age, their skin starts to dry out more, so we see another peak of eczema in adulthood, say around the age 60.
Okay.
And the main treatment for eczema is actually just adding back moisture to the skin and trying to
is.
lock
Lubricant.
in moisture. What I tell people is that you need to take showers that are not too hot, because the hot water actually does strip oil out of the skin.
Okay.
To use mild moisturizing soap like Dove soap, sensitive skin soap, and to put on the moisturizing cream when you're still a little bit damp, just a little bit of water on your skin. And the moisturizers that I prefer are ones that are actually in a jar. Moisturizers are actually a cream.
Okay.
To make, say Lubriderm or something that's in a pump bottle, they take the cream, add water to it to make it pump. So it's just a diluted version of a cream.
Does that work for even moisturizing your legs or arms after a shower? Is that when you recommend?
Definitely. Even if you don't have eczema, when you moisturize, it's best to do it after you shower, leave a little water on your skin, just a little bit. I say people kind of pat dry, kind of with the towel, and then spread the cream all along on the top, and that's the best time to moisturize.
Do you recommend that for both men and women to moisturize their skin? Is it good? You get dry skin during the winter. I mean, does that help to actually do the topical moisturizers?
It does. I mean, nothing bad is going to happen from having your skin a little dry. What I see is that people get to a point where their skin is so dry that they start itching, and it actually can change into an eczema dermatitis. And so to prevent that from happening down the road, it's good to get in the habit of putting moisturizing cream on.
Makes a lot of sense to me. We were talking before about rashes. At what point do you recommend someone come into the dermatologist? How do we know if something is significant enough to be seen by the physician?
Right. A lot of rashes are actually handled by the primary care doctors. If you have a family practice doctor or an internist, they actually treat a lot of conditions like poison ivy or shingles or things that are more acute. When the rash is unknown, the primary care doctor maybe isn't sure what's causing it. If it's prolonged, then they usually will refer you to a dermatologist for further evaluation. So sometimes we have to take biopsy samples or do further testing to figure out what's causing the rash.
Is the majority of your practice personally, are you doing a lot of cosmetic, a lot of skin cancer? What do you see down here?
We see a lot of skin cancer. That's probably the highest percentage of diagnoses that we treat here. We probably see maybe 15–20% of the practice is cosmetic. A large portion is skin cancer or skin check, skin exam, and then another portion kind of falls into the acne, warts, rashes, rosacea, those type of things.
What can people expect when they come in for their very first kind of skin screening, if you will?
Right. That's a good question. Well, I like for people to come in, especially women, without makeup on. That's a really important thing to do, and some people forget.
Yeah, that makes sense.
And a lot of women bring their makeup so they can reapply if they're going to go somewhere after the appointment, but that really helps. I do check everyone's scalp. I look through everything there, so it's nice to have your hair kind of not tied up or too much hairspray. That's important. I will check your scalp.
Now, when you check, are you checking all through it, or just parts, or how do you?
Well, as much as I can to check through it.
Okay.
And then we check everything.
Looking for?
We're looking for moles that are atypical, precancerous spots, just different lesions that could be a problem.
Okay.
And we check kind of from head to toe. So we actually also check all the way down to the toes and the feet. When you come for a full body exam. In terms of, genital areas or areas underneath underwear, I kind of leave that to the patient. Typically they can leave those on and I can kind of look underneath, but if anybody wants, more examination than that, we do that as well.
Are there areas that are more prevalent for getting skin cancer? You talked about the face and things like that, but...
Right. For most types of skin cancer, it's going to be the sun-exposed areas. So most places we see skin cancer are the face, the forearms and hands, neck. The upper chest and back is also a big area because that's another area with a lot of sun. For some women, the legs, if they spend a lot of time tanning and trying to get tan, the lower legs will be another area prone to skin cancer.
Now, once let's say you find a couple of spots and you're like, oh, this looks funny, or maybe we want to get rid of this, or this is a pre-cancer or whatever, then what happens? What do you just make note of it? Do we treat right away? Do we talk about protocol?
Right. Well, depending on what the lesion is, we do have a lot of people who have precancerous areas. These will typically be little small red kind of scaly patches. People will tell me it gets rough and then I pull a little flake off and then it comes back and it gets flaky again and I scratch it off. So those are precancerous, called actinic keratosis. Okay. And those can just be sprayed with a liquid called liquid nitrogen, and it just freezes the lesion and causes it to scab up, crust up, and then it just peels off.
What is it actually doing? It's just...
The liquid nitrogen is actually killing the precancerous cells by freezing them.
Okay.
So that can be good because you can prevent things from progressing to skin cancer, or if you can catch them at that precancerous stage and treat them easily without surgery.
Makes sense.
And that way you can avoid having, stitches and things removed down the road. So people who have a lot of precancerous lesions usually come about every 6 months, and we try to stay on top of what they have.
Which makes sense. And then you treat those right away.
We treat those usually that day they come in.
And then if you see something that's suspicious.
Right. If you see something that's suspicious, say they have a mole that's irregular, dark, we want to make sure it's not a melanoma. Right. We would do a biopsy sample, and usually we do that the day they come in as well.
And how is that? How is that done?
Well, a small amount of local numbing medicine is injected right under the lesion.
We want to know exactly what we're getting into.
It's a small little shot. It's very quick, lasts a few seconds. And then after it's numb, I just come back and take a sample of the lesion. Sometimes it requires stitches, sometimes there's no stitches. And then that little mole or lesion, whatever we took off, goes to the pathology lab, and a pathologist looks at it under the microscope, and then they report back to us on what it is, and we then decide and let you know what needs to be done.
And typically, what are treatment options at that point?
Well, various things. Sometimes things are, once again, in the precancerous stage. They can be frozen with the liquid nitrogen, a spray. Some things can be scrape and burn, so we just use a little instrument that scrapes the skin cancer, and then we cauterize the top.
You love your job, don't you?
And then some things have to be actually cut out with stitches and sent out to make sure that the whole lesion is removed.
You are fun to talk to. I really appreciate you taking time today. Thank you, Dr. Traywick, for joining us here on Healthy Living. We want to thank all of you for joining us here on Healthy Living. Have a great day.